Hi. Many patients commonly ask what is the difference between our USA tennis elbow procedure and traditional approaches to releasing the lateral fascia of the elbow or traditional open tennis elbow release. Well, there's several differences, and these differences are reflected in the recovery time and the pain and swelling after surgery. Traditional open tennis elbow release involves a large incision over the lateral elbow in order to release the lateral muscle fascia of the extensor tendons to the fingers. These attach to the lateral elbow, and over time, with activity, the tendon and muscle unit can get shortened and cause pain and swelling and degeneration on the side of the elbow. Traditional procedures are usually done in a hospital or surgery center environment, which is more time-consuming and expensive for the patient. They also involve more invasiveness, meaning they take down the tendon, strip it all off bone. Sometimes the bone is cut on the side, and then all the muscles are repaired to the side of the elbow. Over the years, I've worked and developed a procedure that involves just releasing the muscle, fascia, and the tendon over the lateral elbow. This procedure is called the USA tennis elbow procedure and is done with a patented device I developed called the tenotome. What we do when we do this procedure is we use high-resolution ultrasound guidance to see the muscle tendon unit over the side of the elbow in order to reduce the size of the incision. We're able to then slide this little device up underneath the muscle fascia under ultrasound guidance and release it, allowing the muscle tendon unit to lengthen. That takes the pressure off the lateral side of the elbow. There's no more pull of the muscle tendon unit, but the muscle remains intact. So patients are able to start using their wrist right away. They're able to start light activities right away, and within a week or two, they're able to do even heavy activities and get back to work without much difficulty. With traditional open tennis elbow release procedures, they make a large incision, they completely release the muscle and tendon, and sometimes have to repair it to bone. Many times patients are placed in a splint and have weeks and weeks of exhausting and expensive rehab after these procedures. With our procedure, there's no rehab involved. People can go back to work after having the procedure on Friday, on Monday, and they can start light activities immediately after the procedure. They can even go back to heavy jobs, such as lifting, within about 7 to 14 days after the procedure. The cost of the procedure is rather low, owing to the fact that we can do it in the office just under local anesthetic. We save you thousands of dollars on this procedure, and many times patients only pay an office copay for the procedure when they come in to get it done. So that's really the procedure in a nutshell. Everybody has questions. If you'd like to hear more about the procedure or schedule an appointment to be evaluated, we can do the evaluation and procedure all in one day. We very often have patients that come from far away, other parts of the United States and even outside the country for our procedures which are office-based. And so just call. Our staff is very well versed in the procedures that we do and can give you an idea of what the cost comparison is going to be if you had the procedure done in our office or another place of service like a hospital or surgery center, and you'll see for yourself that will save you thousands of dollars and will save you weeks and even months in some cases in recovery time. So if you're interested in hearing more or would like to schedule an appointment, please visit us at our website or call our office.